Hello, hello. We are here, we're live, and we're about to talk about a topic that affects every woman. I hope you are ready. I hope you have come with your questions and an open mind to learn because we have a wonderful 60 minutes ahead for you. We'll be talking with some experts and it is going to be a rewarding time. So, thank you for joining in. Thank you for tuning in. Thank you for linking up. Our mission today is to bring education and awareness to women out there. We know that when a woman knows her body, she's empowered to make healthier decisions. She's equipped to advocate for herself and live a fuller life. That is our mission today, to make sure that women are empowered and also equipped with the right information to make healthier decisions. I know that we have all been a victim of what I'm about to say next. So let me know in the comments if you have ever Googled a symptom before that you did not understand. Go ahead and type yes, drop a yes in the comments or an emoji to say, here I am. I want to know that I am not the only one who has Googled a symptom because they could not understand what was going on. So I'll just give us a few seconds to do that before I introduce our very vested experts who will be helping us dissect this topic so that everyone understands more about their bodies and what they should be doing to live healthier lives. So go ahead, drop in the comments. Have you ever Googled a symptom before? Have you ever been disappointed with the results of those symptoms? So go ahead and let me know what it is for you because I know I have. Okay, keep it coming. Keep it coming. Amazing. Okay. We are going to be talking about Know Your Body, women's wellness and self-awareness. And today we have two experts that will help us make sense of this topic and increase our knowledge and our confidence as women. Because when we know our bodies, when we know what to expect, what is normal and what is not, we would take prompt actions. We would also, advert or reduce some emergencies because when we act faster, when we act, with intelligence, we'll be able to live healthier lives and we'll also be able to help others who come after us and who experience the same issues. So this evening, I just want to introduce Dr. Orobola Ojo. These days that we opened up the links. Today, we want to bring her up to help us do justice to this question, knowing your body, or this discussion we're having today. So Dr. Orobola Ojo is here, and she is going to be helping us, do justice, like I said, to our questions. And she has spent years sitting across women, navigating everything from everyday checkups to some of the most vulnerable moments of their lives. And as a consultant family physician, she brings both clinical depth and real human understanding. She understands what women go through. And we know that she's also a strong women empowerment and women wellness advocate. So thank you, Dr. Ojo, for being here. Please let's welcome her in the comments with some emojis. Thank you so much. Also, we have a wonderful nurse, and she is also going to be, doing justice to our topic. And she is Nurse Chisom Ibeanusi. She's a UK-based critical care nurse. She's a counselor. She's also a relationship and marriage coach with a passion for helping women live healthier lives, self-aware lives. And she combines her medical background with her work in emotional wellness to empower women to better understand their bodies and make confident health decisions. And through her teaching and coaching, she helps women build greater self-awareness in both their physical and emotional well-being. So let the emojis come rolling in. Give them a warm welcome. Give them a beautiful welcome. They have taken time out of their busy schedules to be here to help us make sense of our bodies and help us answer our questions. Okay, I can see the emojis coming in. Thank you so much. Thank you. Thank you, everyone. Keep it coming. Keep it coming. Great. Amazing. Okay, so Dr. Ojo, let's start with you. We talk a lot about listening to our body, but so many women have spent years being told that their symptoms are normal. Don't stress about it. Oh, it's in your head. Just forget about it. Where do you see that most in all of your years of practice and deep experience? Where do you see that happening most, and what does it cost women when they stop trusting themselves? I know that you have a wealth of knowledge to share with us, perhaps in some slides and educational props, but before you begin, I just want to understand, where do you see that happening the most? Yes, Ma, you can unmute and take the floor.
Can't seem to hear you. Can you hear me?
Yes, we can hear you. Please go ahead.
Okay. Thank you very much for having me here. Okay, so to answer your question, when do we see female complain about all these things most? Most of the time is when they are finding it difficult to conceive. That is when we have these kind of questions come up the most. Then transitioning from puberty to adulthood, again, we have this coming up as well. Okay, so when it has to do with fertility, we have people asking questions. When we see newly married couples, we have them asking questions, because when they don't conceive on time, they begin to ask questions. Am I okay? Am I not okay? Am my hormones deceiving me? And all that. Then when we also have people that have irregular menses, irregular menstruation, then they begin to ask questions as well. What is going on? I've not seen my period for so number of months and all. So that's when, those are the times we get all these questions coming up the most. When we need to get pregnant and it's not coming, or when a child attains puberty and menstruation is not coming, is delayed, and other developmental character and sexual characteristics, they are delayed, then we get parents asking questions as well. Then when they develop too early, because nowadays we see precocious puberty, then we get parents asking questions concerning their girls as well. So those are the times we get all these questions come up. Okay.
Oh, thank you so much. I'm sure that you have more to share with us. You have prepared something, and we are ready to consume it. If you are ready, then we can dive right in. Okay, so Dr. Joe will be sharing with us. Let's just sit tight. Today we are going to learn very well.
Okay, will you be sharing the slides, please?
Yes,
I think I have
just
a
a
few.
moment.
Yeah.
Okay. Okay, while we wait for the slides to come up. Yeah, the slides are up. All right, Dr. Joe, the floor is yours.
Okay. Okay, so I'll just be talking briefly about the female hormones and the menstrual cycle, because we need to understand what hormones we have, why they are there, and their functions, so that when we have questions, we'll be able to know where the problems are coming from. Then I'm also going to explain briefly as I can in layman's language what the menstrual cycle is all about. Okay, so let's dive into it. So understanding your hormones. Now I'll just talk about the main female hormones. Of course, there are several hormones in the body, but when it comes to reproductive health, we are talking about these hormones. We have the estrogen. There are two spellings. We have the one with the O and the one without the O at the beginning. So we have the estrogen, we have the progesterone. I'm sure we are familiar with estrogen and progesterone. Then testosterone, you'll be wondering, testosterone, isn't it a male hormone? Yes, it is a male hormone, but we have it in our body, in the female body as well, to some level, not so much as that of the male. So we have the testosterone. We have what we call the follicle stimulating hormone, FSH for short. We have the luteinizing hormone that we call LH. Okay, so these are the main female hormones. Okay, so let's go to the next slide. So what are the functions of the estrogen? The estrogen helps the woman or the female to develop the secondary sexual characteristics that we see. The common ones that we know is the breast development. So when you see your breast developing, that is the estrogen in action. Then the shape of the hips. As you grow into puberty, the shapes of the hips begin to change. That's the function of the estrogen. Then of course, menstruation. The estrogen also helps with menstruation. So these are the main secondary sexual characteristics that we have in the female. And this is the work of the estrogen. But there are also some benefits that the estrogen has in the body. It helps with bone density, with bone growth. Okay, it helps with the hair growth. It helps with skin growth, with glowing of your skin. When you see your skin glowing, it's not just anything, no, it's estrogen that is in action. Do you understand? It helps to regulates the cholesterol level. The cholesterol level in the body. I don't know if you have heard about bad cholesterol, good cholesterol, and all that. So estrogen helps with regulating this cholesterol. It promotes good cholesterol and it protects the heart. It also helps in brain, in memory, in libido, in regulating body temperature. As we go on with this program, you'll find out why the body temperature is very important. Okay, it also thins out the cervical mucus, getting it ready to accept the sperm. It thins it out. Okay, it also lubricates the vagina, making sex enjoyable. So you'll see all this when it comes to menopause. You'll see the effects of this estrogen, because during menopause the estrogen tends to go down. So you now get the opposite of all these benefits during menopause. Okay, vaginal dryness, loss of bone density, loss of skin integrity, and all that. You begin to see it during menopause, because during menopause the estrogen level drops. So these are the main benefits of estrogen. I don't want to bore us too much with so much information, so that we can grab the important ones. Just know that the estrogen is responsible for female secondary sexual characteristics. The next slide, please. So we have the progesterone. In simple terms, progesterone is a pregnancy hormone. It's the main pregnancy hormone. Although the estrogen also supports pregnancy, but let me just let you know that progesterone is the main pregnancy hormone. It also helps to regulate menstruation. So progesterone too is important in the female. Then here we come with testosterone. Now testosterone, we have it in little quantity, not as much as the male testosterone, very little quantity, because it also supports libido, it supports bone growth and muscle strength. When you see some people that are very muscular, they probably have a higher level of testosterone than other people. So to some extent, we also have testosterone in our bodies. Then we go to the FSH, that's the follicle stimulating hormone, and the LH, the luteinizing hormone. Their main job is to help during ovulation. The FSH helps to develop the follicles. The follicles are present in the ovaries. The follicles release eggs, okay? So the FSH helps in the development of these follicles, like the name suggests, follicle stimulating hormone. So it helps to develop these follicles. The LH is also very important in ovulation. Don't worry, you understand why the LH is important when we get to the ovulation aspect of this program. Okay, so the next slide is just a pictorial view of the functions and actions of the estrogen. If you can enlarge it a little bit so that they can see that. The brain, I talked about the brain, the functions of the brain. I talked about the breast development. It helps, you can see that there's an arrow pointing to the liver. That's where the cholesterol regulation takes place, formation of cholesterol and all. So it also helps with increase in fat store. That's the cholesterol thing. Then also helps with maturation and maintenance of bone density, like it helps with bone formation and bone growth. Then again, menstruation and ovulation. Okay, this is just a pictorial view of the actions of estrogen in the female body. Let's go on, please. I hope you are understanding now. The estrogen, the progesterone, the testosterone, the FSH, and the LH, the importance of these hormones in the body. So we'll go to the menstrual cycle. I've made it into a pictorial view just to make this very short and explanatory. So the menstrual cycle starts from the day you start bleeding for your menstruation. The very first day of your menses, that's when you start seeing blood. That is the day your menstrual cycle starts. That is day 1 of your menstrual cycle. The first day of your menstruation is the day 1 of your menstrual cycle. And it goes on like that until you see the next menstruation. So that is the end of one menstrual cycle. The beginning of the menstruation of one menstruation to the beginning of the other menstruation, that's the next menstruation, that period in between is called the menstrual cycle. I want us to understand that period in between is called the menstrual cycle. Like if you go to a healthcare provider and the healthcare provider asks you, how many days do you have in your menstrual cycle? You should know that the person is referring to the number of days between the first day of your menstruation to the next first day of the next menstruation. So the person is referring to the number of days in between. So you start counting from the first day as your day one. So that is the beginning of your menstrual cycle. Now, this menstrual cycle is divided into phases. You don't need to bother your head so much about these phases, but I'll just explain to you what goes on during these phases. So the first phase is the menstruation phase, right? The day you begin your menstruation to the end of your menstruation, that's your menstruation phase. And these days, it can last between 3 and 7 days. Some people can bleed for 3 days, which is okay. And some people can bleed for as long as 7 days, which is also okay. So it is normal. So your menstrual days should be between 3 days and 7 days. If it is lower than 3 days, it is short. If it is longer than 7 days, it is long. Now you know that there's a problem. So it has to be between 3 days and 7 days. Okay, so that's the menstruation phase. Then you now have the follicular phase. The follicular phase and the menstruation phase, they kind of overlap. But don't worry your head about that. But just know that in this follicular phase, after the menstruation stops, then the follicles, that's where we get the follicular phase from. The follicles begin to develop. That's the follicles are present in the ovaries. You see the structure in the middle of this circle? That's the shape of the uterus, the fallopian tubes, and the ovaries. I don't know if I can get a precursor to just go around to help highlight the uterus, the fallopian tubes, and the eggs, and the ovaries, rather. Okay, so the follicles begin to develop in these ovaries during the follicular phase. So in this follicular phase, you have the FSH in action. Okay, so during the menstruation and follicular phase, the estrogen continues to rise. Your estrogen is in action, it continues to rise. All right, now let me mention that during your menstruation, what causes bleeding is the breakdown of the uterus, that's your womb, the inner lining of the womb, the breakdown, the shedding of that wall. That is what causes the bleeding. Now, by the end of this menstrual cycle, you will understand why there is a bleeding during menstruation. Just know that for now, it is the shedding of the inner wall of your womb, of your uterus, that is causing the bleeding. Okay, so now we go on with the follicular phase. The follicles begin to develop, the FSH, begins to rise to support the follicles, helps them to develop, and then it continues like that until it gets close to ovulation. Then one follicle out of all the follicles that are developing, just one matures and then releases the egg. Then the release of this egg is called the ovulation. Then you get to the ovulation phase. For a regular 28-day cycle, the ovulation phase is usually the mid-cycle. That's middle of the menstrual cycle. So you have the ovulation, but it differs depending on the number of days in your cycle. That is why you should know the number of days in your cycle so that you'll be able to calculate your ovulation day. Okay, so it differs. Some people it is not 28, some people it is up to 30. Now the number of days in the menstrual cycle can range between 21 days and 35 days. Some people it is 21 days, some people it is 35 days. But if it is shorter than 21 days, then you have a short cycle. If it is longer than 35 days, then you have a long cycle. So those ones are not normal, they are abnormal, they are outside the 21 to 35 days. Okay, so let's go on. So once you get to ovulation, the egg is released. Okay, so the egg stays for some time. The next speaker is going to explain to you how long the egg stays and all. Let me not take apart. Okay, so the egg stays for some time here in the ovulation period, and then it goes on waiting to be fertilized by a sperm. Okay, it waits. Once it's released, it begins to wait to be fertilized by the sperm. Then it gets to the luteal phase, where it begins to wait to be fertilized. While this is going on, there is production of progesterone. Now, the progesterone goes to the womb, to the inner lining of the womb, waiting for fertilized egg, thinking that, okay, this egg will be fertilized soon. Let me begin to prepare the walls of the uterus. Let me begin to prepare the womb, ready to implant a baby. So it begins to thicken the wall of the uterus, begins to prepare the walls of the uterus, expecting a baby. Okay? That's the work of the progesterone. So at that phase, the progesterone rises, thinking that, okay, a baby is coming soon. Let me begin to prepare the walls of the uterus. But then, if there's no fertilization, no sperm comes to fertilize this egg at this stage, then the egg disintegrates because no fertilization. The egg only has a number of hours to be alive. Let me just put it there. Then the egg dies, it goes up, it dies off because there is no sperm to fertilize it at this stage. So once that happens, then the uterus, the progesterone becomes sad because there's no fertilized egg, there's no baby coming. So it begins to drop because no baby is coming. I can't continue to prepare this womb. It begins to drop again. While it begins to drop, then the walls of the uterus begins to shed because there is no progesterone supporting it anymore. Then we get back to this stage of the menstruation. So that is what causes the bleeding. No baby, so there will be menstruation. The wall breaks down again and bleeding occurs. Then the cycle goes on and on like that, from menstruation back to follicular phase, back to ovulation, then luteal phase, no fertilized egg, then the wall breaks down and you see your menses again. So I hope I've been able to explain to you this menstrual cycle. So this whole menstrual cycle occurs between the first day of the menses to the next day of the menses, to the next first day of the next menses. So here I have just a simple definition of the terms that we use. I've explained the menstrual cycle as the first day of menstruation to the next first day of the coming menstruation. Okay, the number of days in between is usually between 21 days and 35 days. That's the number of days in your cycle. That's the second one. Then the next one, last menstrual period. You know that when you go to the healthcare provider, they ask you, when was your last menstrual period? But when they ask you when was your last menstrual period, they are referring to the first day of your last menses. That first day, they are asking for the date of that first day, not the last day. The first day your menstruation started, that's the last menstruation. That first day, they want you to give them the first date. So that's what they mean by your last menstrual period. Then ovulation is the release of eggs from the ovaries. Then we have premenstrual symptoms. You know, there are some people, when they're about to see their period, they begin to have some symptoms, some signs like breast pain. Oh, my breast is paining me. Some of us get abdominal cramps. Some of us is mood changes. Some people get diarrhea. Some people vomit. So all these symptoms are referred to as premenstrual symptoms. That is before menstruation, the symptoms you see before menstruation. And it can also last all through the menstruation period, but it's expected to stop after your menses. Okay, the next slide, please. I think we are going to the end. All right, menstruation. We all know menstruation, the bleeding period. That's the menstruation period. And it's usually 3 to 7 days, like I said earlier. Anything less than 3 days is not normal. Anything above 7 days is too long. Okay, so I think that's my last slide. I hope I've been able to explain to some extent. Oh, I still have one more slide, please. How to track your menstrual period. Yes, before we forget. How do you track your menstrual? There are many apps these days that you can use to track your menstrual period, you know. Once you get the app, you can track your menstrual period. But I want you to get the basics, the logic behind these apps. That's using the calendar method. You should understand how they came about this tracking of menstrual period. I've already explained to you what your menstrual cycle is. So on your calendar, the first day you see your menses, the first day you see blood, you mark it on your calendar. That is the first day, day one of your menstrual cycle. That is day one. Then you continue to mark each day, like it's on the screen. Each day you can use any symbol, X, correct sign, or any symbol to identify it. Then you continue to mark it until the last day of your menses. If you look at this calendar now, this person marked 1, 2, 3, 4 days. So if I ask this person, how long does your menses last for? She will tell me 4 days. Okay, so this is normal. It's between 3 and 7. 4 days is between 3 and 7. So this is normal. So this is the menstruation period. But then you continue to count. The first day, that's the 7th, is day 1. Continue to count day 1, day 2, day 3, day 4, day 5, 6, 7, 8, 9, 10. Continue to count until you see your next period. That's the following month, the first day you mark it. So this first day in January to this last day before the first day of February is the number of days in this person's cycle. Okay, so let me give you a short exercise, all right, so that I will know if you are following me or not. How many days is in this person's menstrual cycle? Can anyone tell me how many days does this person have in her menstrual cycle? So that will be the last slide for today from me. Then we'll take on your questions. Thank you very much.
Thank you so much, Dr. Ojo. You have unpacked a lot of knowledge for us. And before I let you go and catch your breath, so you talked a lot about hormones and what they do. And I just want to bring a question here from one of our followers, from someone in our community. And she says, what are the safe practices concerning weight loss for women in their 40s? I've been trying many things that don't work. Because I know that some people have Googled and they have found out that, oh, hormones are responsible for you gaining weight. It's not about what you eat, it's not about what you're doing. So, what would you say to this person? Is it hormones or is it something else? How does she go about the weight loss journey?
Okay, so there are many factors to weight gain. Okay, for some people it is hereditary. Some people cannot escape it because it is inherited, it's along their bloodline. But then again, estrogen is also known to cause weight gain. Okay, it is known to cause weight gain. This is very important especially for people that are on hormonal therapy or people that are taking oral contraceptives that are on estrogen pills. So you can gain weight with estrogen pills. It can cause weight gain, but it is not responsible for the weight gain for everybody. Like I said, there are many factors, other factors responsible for weight gain. But yes, it could be one of the factors.
Okay. Oh, thank you so very much. You have done so well. I wish we could let you go on and on and on because I was enjoying it so much. And I know that those who are listening, those who are tuned in, are getting value. But I just want to pass the ball now to Nurse Chisom. And I know that she is ready to give us our own perspective and share from our own wealth of knowledge and years of experience. Because yeah, she sits at that crossroad or that place where body and emotions collide. And as a fertility counseling perspective, from that perspective rather, Nurse Chisom, what are the signals women most commonly come to you, about having, experience time to time or that they have overlooked for years. So I just want to ask this question so that just to usher you into your segment. So Nurse Chisom, if you're with us, please come on board. This question is for you. What are those things that women experience that concerns their body and could also, have to do with their emotions? Nurse Chisom, are you with us? Okay, if you're speaking, you're muted, ma'am. Please unmute. We can't
Can you
hear
hear
you
me
right
now?
now. Oh, perfectly. Yes. Please go ahead. Did you hear the question or can I bring back?
Come again, please.
Can I
I
say
was
it again?
Yes, yes, yes.
Okay. So I was asking from your perspective of a family fertility counselor, what are those signals that women ignore, those common ones that they've overlooked for years, that has to do with their bodies and their emotions?
Okay. Thank you so much, everyone. Thank you, Joy. Thank you, Dr. Joe, for that wonderful presentation. First of all, I would say that a lot of women avoid tracking. They avoid tracking what's happening in their body. We overlook what our body is telling us and we look outside. We focus on
Yes.
what are people saying? I'm expected to get pregnant now. It's already 1 year. I just need to get pregnant. But we ignore what our body, our mind, our system is telling us every
Yeah.
month per time. So we are focused on what is expected of us. We are expected to get pregnant. We are expected to, you know, but we avoid to listen internally. We avoid to track. I love using the word track because our body system as a woman is a rhythm. Is a rhythm. We track it. So most women they come to me asking a lot of questions and it boils down to tracking. What's your body saying? What are you hearing? Are you listening to your body? And no, we don't. And that's why I'm very glad and um, I'm saying well done to VivaFemini for this program. Thank you.
Thank you so very much. Okay, so we'll quickly let you go into your own slides, what you've prepared for us. I know that you're vested, you have experience, so you will do this in the next 15 minutes because it's
Oh,
hot
okay.
and the women want to hear it, they want to have it. So over to you, ma'am.
Thank you so much. Thank you so much. I really want to appreciate Dr. Ojo once again. She's done justice to the majority of what we need today. She's talked
Yes.
about the hormones, and those are the important lesson we need to learn today because our hormones are the ones doing the talking. Then our bodies are reacting to what's happening inside. So, first of all, I want to tell a short story. A lady came to me a few years ago. She was saying, she was talking about her period that it's been inconsistent and she's been trying to get pregnant for 9 months. And I'm like, oh, she was scared. She was convinced that something serious is happening in her body. And I asked a very simple question, which I'm asking every one of us today. Do you usually track your cycle? And she said, huh? What's that? Okay, I said, okay. What about your ovulation? When is your ovulation? I asked. At that moment, it became so clear to both of us that many women are struggling, but nothing is wrong with our body actually. We are struggling because we are thinking something is wrong, something is not right, but that is not the truth. That is not the truth. And that is exactly why we are here today. If we understand our bodies, what's going on, we will make a better decision about our health, we make a better decision about fertility and our well-being. So I want to ask everyone in the chat, have you ever tracked your cycle before? Write me a one in the chat if you've tracked your cycle before. And how many of you know your average cycle before? How many of you know your average cycle? Your cycle length? I want to see a two in the chat. If you know your cycle length, give me a two in the chat. If you've tracked your cycle before, give me one in the chat. Okay. Can I see a one or two in the chat? One. Okay. I can see a one. Thank you so much. First of all, Dr. Jazz talked about the cycle. We've known that we have the menstrual phase, the follicular phase, menstrual phase when the menses is coming out, the I want us to, can I control my slide by myself?
Also, just tell him where you want it to go.
Okay.
He will help you control it if that's okay.
Okay. That's fine. Okay. Can we go to page 4, understanding ovulation and fertility? I think Dr. Jazz done the menstrual cycle, so we just go straight to the ovulation, please.
Yes, she did.
Oh, okay.
Okay, so
Understanding.
page 4.
Yes. Thank you. Ovulation. I'll continue until the slide is ready. I want every one of us to imagine something simple. Imagine that your cycle, as Dr. Joy explained, your cycle as a circle, yes, as a circle like this, of about 28 days. At the beginning of the cycle is your period, right? Then your body, at the beginning is your period, then your body begins to prepare for egg. Around the middle of that circle is ovary releases egg. That's the ovulation. That's the moment that is called ovulation. And this is the key thing. The egg only survives for about 1 day. The egg only survives for about 1 day. So pregnancy can only happen if sperm meets the egg during that short window. So I'm focusing on ovulation because that's where pregnancy happens. That short period when the ovulation is out, when the egg is out, is called the fertile window. So let me come again. The beginning is your period, the middle is your ovulation, and after ovulation, your body prepares the next cycle, right? And if a woman understands this cycle, it becomes easier. When you're talking about pregnancy, you know that there is a window called the fertile window to get pregnant. So that leads me to tracking. The sperm can only stay in the body for about 5 days, 3 to 5 days. And the egg that we are going to pursue stays for about 12 to 24 hours. So this fertile window is between, let me say, 5 days. 5 days before the egg comes out and the day the egg comes out. Can we still hear me? Can we still hear me? Okay, I'm trying to, let me check the chat. Oh, yeah, okay. Oh, yes, thank you. So, ovulation happens when an egg is released from the ovary. The egg lives about 12 to 24 hours. And I said sperm can live up to 5 days. So this creates the fertile window 5 days before ovulation and the ovulation day. This is when pregnancy occurs. Can you go to the next slide, please? So how do we track our cycle? What are we tracking and how do we track it? Cycle tracking helps you understand your body pattern. We can't do everything. We can't finish everything we are saying today without talking about tracking. So you track your first day of the period, as Dr. Joy explained, the first day of your menstrual cycle to the first day of the next menstrual cycle. That's the cycle, full cycle. So you're tracking the first day of your period. You're tracking your cycle length. The cycle length. So the cycle length, you're counting, count from the first day of one period to the first day of the next period. Then you are tracking your body symptoms. You're paying attention to your mood changes. You're paying attention to energy levels. You're paying attention to body cramps you're having, the breast tenderness. It means you're aware of what's going on in your body. You are saying, okay, during this period of my cycle, I have breast tenderness. I have pain in my tummy. You are being aware of all that. Then you're tracking something else, cervical mucus. Around ovulation, cervical mucus often becomes very clear and stretchy. Similar to egg white. We know egg white is similar to egg white. This can be a sign that ovulation is approaching. Some people even say that sexual urge is higher here. I don't know if anyone has experienced that. I don't know if anyone can relate. So when you keep track of these symptoms, it will help you to understand your body patterns. Then when it comes to fertility awareness, one common misunderstanding many women have is thinking pregnancy can happen any day of the month. That's why I explained ovulation. Biologically, pregnancy usually happens within that fertile window I talked about 5 days before ovulation and on the day of ovulation. Why? Because sperm can stay for 3 to 5 days. So if the sperm came out on the third day of your ovulation, that ovulation window, if it came out 3 days before your ovulation, you can still get pregnant because it will stay in the system and meet the egg when the egg is out. So you can get pregnant within this fertile window. When every woman understands their fertile window, they can make informed decisions about family planning, about trying to conceive, about your reproductive health. When we talk about pregnancy tracking, do you know you can track your pregnancy? For example, when you now get pregnant, when we talk about pregnancy tracking, I want us to talk about that. Because that is one area a lot of women don't pay attention to. Pregnancy is not something you just discover, then you wait for 9 months and the baby arrives. No. Pregnancy is something that must be actively monitored and followed. Do you know why? Because pregnancy tracking helps two lives at the same time, the mother and the baby. And there are 4 important things I want you to track when we talk about pregnancy. Can we go to the next slide, please? First of all, tracking helps women monitor pregnancy progress, baby development, health symptoms, and medical checkups. When I say pregnancy progress, how do we do that? Normally, pregnancy lasts for about 9 months. That's about 38 to 40 weeks. The doctors normally prefer weeks because that's more realistic. What do we track? We are tracking how many weeks, how many months pregnant the woman is, the expected date of delivery, how much weight the mother is gaining, how the uterus is growing. It's very important. When the baby starts moving, if you're not tracking, you won't know the baby is meant to be moving and when the baby is not moving, and that's dangerous. Those are the things we track when a mother is pregnant. So around the middle of the pregnancy, you should be feeling the baby kicking. And that's you being sensitive. This baby is supposed to be kicking now. It's a very important sign that the baby is active and developing. So pregnancy tracking helps us to know if everything is progressing normally. That's number one. Then number two, you track baby development during pregnancy, right? That's the second thing we monitor. Baby that is inside the womb is developing per week. From the beginning of the pregnancy, the baby is growing different organs, the liver, the brain, the kidney, all the organs are growing. So the doctors and midwives, they are monitoring the baby's size, the baby's weight, baby's heartbeat, how the organs are developing, how the brain and the lungs are forming. We use ultrasound scan to do that. I know when we go for scan, we are very emotional as women. We are looking at the baby kicking. But medically, those scans are helping the doctors to confirm that the baby is developing. So those are the things we do in pregnancy. Then, thirdly, we monitor the health symptoms. Pregnancy affects the whole body. So healthcare providers, we pay attention to how the mother is doing. That's very important. Some common symptoms we see in pregnancy are nausea, vomiting, tiredness, back pain, swelling of the feet, heartburn. They are normal, yes. But we also monitor more serious health indications such as blood pressure, blood sugar. Your blood sugar level in pregnancy is very important. Iron level in the blood is very important. So that some women become anemic during pregnancy. So we monitor that. We do urine tests also for infections. These are very important. What are we checking? We are checking for diabetes. Some people have gestational diabetes when they're pregnant, high blood pressure in pregnancy. Some people become anemic in pregnancy. So that's why we are tracking it. So tracking these early helps the healthcare professional become more proactive in the care of a pregnant woman. Then we also do medical checkups. This tracking helps you to know when to go for checkups. Antenatal visits, it helps you to know this period of your pregnancy, you go for antenatal visits where they do all the urine tests, do all the ultrasound. They do the dating scan. We do the dating scan early in pregnancy to confirm the due date. Even the anomaly scan, we do them to confirm the baby organs are developing. We do the growth scan later in pregnancy to monitor them. But when you're not tracking, you might even forget when you need to go for what. That's why we track it. And these appointments are very important to detect any early issues and treat the pregnant woman. And that's why a lot of technologies tracking apps are being developed to help a woman be in check and be in control of their journey. So to round up, many people think health is only the responsibility of doctors. No, the truth is the first person responsible for your health is you, especially as a woman, is you. So I want you to build confidence. I want you to build the confidence today to take personal wellness, your personal health serious, to be intentional, to care for your health. And it starts from your body. Understanding your menstrual cycle, noticing any unusual symptoms. Pay attention to your bodies, because your body is not confusing. Your body is communicating with you. And when every woman here understands their cycle, understands fertility, any health pattern, you will gain confidence, you gain awareness, and you control your body. And every woman here deserves to understand their body. Thank you so much. Thank you. I know it's, I should round up, right? I know my time is off. My time is off.
Uh, you're doing very well. You have done very well, and from all that you've said, and even from what Dr. Ojo said during her session, one word keeps popping up, and that is tracking. Okay,
Yeah.
track these things, track your fertility, track your menstrual cycle, track your pregnancy. And that is where Viva Femini is standing solid to make sure that women have the tool, to help them do this tracking. Because when you track early and you understand what's going on, you will be able to know what is abnormal and what is normal, and then you can take prompt action to mitigate any emergencies. I hope I'm on track, Nurse Chisom.
Yes, 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 yes.
Oh, okay. So before we wrap up, we're almost coming to the end of this very sweet educational meeting. I don't want to call it a webinar because I'm being educated, and I know that everyone who's watching and those who will watch later are going to have a wonderful time, digesting all of this knowledge. Okay, so I just want to ask some of the questions that came in while you
Okay.
were speaking. And one said it also touched on these hormones again. It said, how can I manage hormonal imbalance? Okay, I wonder if you can do justice to this question in the next 60 seconds. How can I manage hormonal imbalance? Maybe a lifestyle change or something. How can she manage hormonal imbalance?
Okay. First of all, can you hear me?
Yes, I can hear you.
Okay.
Go ahead.
First of all, I've gotten lots of that question, and the first thing I ask is, how do you know you have hormonal imbalance? Because I know social media have made a lot of, everywhere you go, we talk about PCOS, we talk about, how do you know that you have hormonal imbalance? Have you been diagnosed? That's the first question I ask. Have you been diagnosed? Because many people are parading with that notion that I have hormonal imbalance because I'm getting maybe bigger than I'm supposed to, or so how do you know? So I want you to first of all make sure you are diagnosed by a healthcare professional, by a gynecologist, by, do you understand? So that's the first thing. Make sure you are diagnosed. Then if you have hormonal imbalance and you are diagnosed, your healthcare professional will guide you. That's number one. It will guide you. But mentally, mentally, I want you to be able to, yeah, okay. Sorry. Mentally, I want you to know that hormonal imbalance is more common than you think. That's number one. It's more common than you think. It's very, very common. So, first of all, get yourself diagnosed. Then follow your doctor's instruction. Track your cycle, track your reading, track your cycle. That's number two. And as you're tracking, I want you to add few things. Other areas of your life. Some of us, someone came to me the other day and was talking about hormonal imbalance and all that. And I asked few more questions. I asked, how is your, how is are other areas of your life? How is your sleep? How is your eating habit? How is your eating habit? How is your sleep? How is your emotional health, wealth? Those are important, added to your doctor's direction. So follow your doctor's instructions. We don't come on here and teach how to follow your, make sure you follow your doctor's direction. That's number one, because it's peculiar. We diagnose it, we know what hormone that is imbalanced in your system, and the doctor will guide you. That's number one. Then added to that, Are you getting enough rest? Are you eating healthily? Then are you tracking what your body is telling you? Are you tracking all your cycles? That's what I want to add. So we don't teach, so follow your doctor's instruction and check other wellness package in your life. That's sleep and eating healthily. Thank you so much.
Thank you so very much. I'm sure that the, the woman who asked that question has listened, and she's taking notes. Okay, so before we wrap up, I just want to see that everyone gets answers to their questions. I know that you're busy professionals, and you need to do other things, go save lives and go care for people who need care. But let me just bring in one or a couple of questions before we call it a day. So I just want to know, okay, so what's one thing you wish every woman in her 20s or 30s should already know? What that one thing? One thing, yes.
One thing.
What? Yes, one thing they should know in their 20s or 30s. They should not be finding out when they're 40 or 50.
Okay. I want you to know, I want you to know and take control of your, I'll be very specific, of your mood,
Okay, great.
of your energy, and your body. Is it three already? Mood is a package. It's a package. I want you
Yeah,
to
okay,
be
go ahead.
aware
Yes.
of your mood, your energy
Food,
level,
yes.
and your body changes. Hold it in your hand,
Okay.
make it palpable, speak it. Know when your mood changes, the time of the month, and be able to communicate it with the people around you confidently. When is that
Confidently.
time of the month that you know that your mood changes? Be aware of it. Say by this time to by this time, I'm cranky, I'm moody, I'm weak, I'm tired, I might not function well. You are in control. If you're married, you're in control. You let them know. Please, I'm triggered at this today to next day. I'm not, I will not be in a good mood, or I'll be very excited. Just be in control. Be in
Okay.
control of your mood, your energy level. There are times you need to call off sick and say, I can't function, I need to rest. And your family, your spouse understands that. Confidently communicate it. Then your body changes, like we just said here. Be in control of this. That's what I want to say. Thank you.
Thank you so much. That was a bumper response, and it's very important. Even though, as a people in this culture, I mean Nigeria now, we still have a long way to go. At least in certain homes and certain realities, we still have a long way to go. When a woman tells you, this today I'm cranky, or the next 2 days I really need rest. It's not something that is common or is practiced, but I believe we'll get there. So I cannot help but pitch in, because this is what Viva Femini is working towards, to make sure that women are supported to enhance their health. You talked about knowing your mood, understanding what your body is doing. This is what we are building to make sure that women have that power in their hands. And yes, it's very important. I wanted Dr. Joe to come take one or two more questions. Maybe she's having a technical glitch, but Nurse Chisom, before I let you go, just one more question. I promise, one more question, and then we can begin to wrap this very interesting time on knowing your body. Okay, so there are a couple of questions, and I just want to. Okay, let just use this as an umbrella one. And this person is asking, how can I stay fit and look naturally beautiful? I don't know if it's a vague question, but I believe you can do justice to it. I know you will be able to answer this one. So, how
How
can I
can
stay fit and look naturally beautiful? So best practices,
Okay.
I don't know.
How can you stay fit and look
Yes,
naturally beautiful?
naturally beautiful. Yes.
Okay. Okay. Is multifaceted. There are a lot of things you can do, honestly.
Okay.
You have to take care of your body. That's what I always preach. You have to take ownership of your body. And is what you mentally define as, you said naturally fit and look beautiful. What do you call beauty?
That is why I said the question is vague. I just
Yes,
read it
yes.
the way she. Maybe let me try and bring a context.
Mm,
Maybe they're asking for little things they can do without maybe taking medication
okay.
or buying products, that sort of thing, and just keep getting stronger and still look chic as they age. Does that
Okay.
help?
Yes, yes. Being fit is being fit. If you are fit, you know you are fit. And for you to be fit, and if you are fit and you are always working towards fitness, you will feel beautiful. So I understand this question comes together, fit and beautiful, naturally beautiful. It takes, first of all, I will say these simple steps. If you follow them, you will be fit and beautiful. Take care of your body. Take ownership of your body. What, but I'm not looking at physical. What goes in? What's going in inside your body? That's very important. In fact,
Yes.
I just, if you focus on that, eh? Without fit, without exercising, definitely I'll touch exercise. But if you focus the next 6 months on what goes inside your body, you'll be fit and you will look beautiful. Mentally too, you will look beautiful. If you focus on
Oh.
eating a balanced diet, more protein, less, that, I know this is a cliche, people have heard it a lot, but it's very important. Hear it from me as a healthcare provider. More protein, less carbs, more water, more, what fuels your body. Focus on what is fueling your body, not because you want to eat. Fuel your body. Be very keen to know what's going inside. Then staying physically fit is very important. I cannot emphasize that. Staying physically fit, monitoring your stress level. Please take adequate rest. I know the hustle and bustle of life is taking toll on our health, but if we can be keen to monitor our stress level, know when to stay still and rest, that will be very important. So prioritize your sleep, prioritize your stress, prioritize your sleep, and prioritize your stress. Yeah.
Okay.
And
So
I
that
know that,
means
sorry, I know
watch
that we
your
want to
your
be fit.
sleep and watch
Yeah,
what stresses you and
yeah.
okay. So just before we wrap up, do you have any last words that you would want people to remember, even if they forget anything else, or before they go and rewind? Because I know more people will want to watch this again. So one thing to take home, what would that
Okay.
be?
Okay. One thing I would want to say is, as a woman, confidence and your inner
Yes.
well-being matters a lot. Confidence and your inner well-being matters a lot. When you feel confident, when you feel good, like I love what it says, fit and good, look good. When you feel good emotionally and mentally, it will reflect outwardly. So alongside what you're eating, alongside the physical fitness, speak well about yourself. Speak well about yourself. Alongside the health, the eating healthy, the physical um exercise, alongside sleep and stress management. Speak well about yourself, about your emotions, about your mental health. Speak well about yourself. It goes a long way, because true beauty is not only about your appearance, it's about also your mental well-being as well. That's what I want to say.
Yes. Okay, that is great. True beauty is also about your emotional well-being. let us prioritize that also. Oh, thank you so much. I actually did not want this to end, but all good things must come to an end. And I just want to say a big thank you to you, Nurse Chisom, and also Dr. Joe. I believe she had to run for an appointment. Yes, the business of saving lives can't wait. So I want to say a big thank you on behalf of the VivaFemini family. You have been so good at, shedding light to this topic, knowing your body, about women's wellness and self awareness. And we just want to say a very big thank you. And to our audience, just to let you know that we talked about tracking, we talked about, checking for those signs, those symptoms. Look out for our app. We're launching soon and we are here to support you. With the VivaFemini app, you'll be able to do all of this, from menstrual to fertility to pregnancy and even mental wellness. You'll be able to do all of this. So we're looking forward to having you come on board and having this tool in your hand and taking back your power, and in making sure that you live the best and the most healthiest life, or the healthiest version of yourself. So please do well to follow us on our socials, at check us out, our website vivafemini.org. Follow us on YouTube, LinkedIn. You can see us everywhere. We have a full community where on WhatsApp, where we answer questions, support each other. You're welcome to join in. Follow us on LinkedIn. Have I said LinkedIn? Yes. So Instagram, not left out. On X, you will find us. We want to be everywhere women are, so that they can have knowledge. For knowledge is indeed power, and that is what we're bringing to the Nigerian women. Okay, so after all of this, please take one thing we have talked about and put it into action. Do something about it. If you need to see a doctor, if you need to book an appointment, please do that. And just have that conversation and make sure that you're on top of your game when it comes to knowing your body. It's not another person's work. Don't follow another person's narrative. Don't follow hearsay and old wives' fables, or what our mothers used to do 50 years ago. Know what is tenable right now. So I'll leave it there. And before we finally draw the curtains, yes, Dr. Joe is done with seeing her patient, and she would want to say a few words in a few seconds. Dr. Joe, please, can you say a last word for our audience about knowing your body, about wellness and self-awareness before we draw the curtains? Hello, Dr. Joe. If you're speaking, you're muted.
Hi, can you hear me now? Hello?
Okay, maybe she's still having a technical glitch. All right.
Hello, can you hear me now?
But I believe that
Yes, I can
she
hear you,
would
Dr. Joe.
also
I can hear you.
advise that you follow your doctor.
Okay, but it seems Joy cannot hear me.
All right.
Hello?
Yes. Okay, go ahead, Ma. Please,
Oh,
a
okay.
last word.
So thank you very much. Yes. Thank you very much. Thank you, Nurse Chisom. You've done very well. Okay, so I think she has said it all. Just know your body. Know yourself. Every individual is different. Whatever I am going through is different from what the next woman is going through. Know your body, know yourself, so that when things go wrong, you can pick it on time. All these things, they come with signs, they come with symptoms. Your body tells you even before it finally breaks down. Your body gives you warning signs. Please don't ignore these warning signs. Eat healthy, adopt healthy lifestyle, exercise, sleep, get at least 7 to 9 hours of sleep every day. It helps you rejuvenate, it helps your body to regenerate and to restart better every day. Don't ignore your warning signs. Okay, so I think that's where I'm going to be stopping this night. Thank you.
Thank you so much. Thank you, Dr. Joe. That was very, very profound. Do not ignore the warning signs. Know what is normal, know what's abnormal or out of place so that you can scream if you have to and arrest the situation on time. So thank you, Nurse Chisom. We really enjoyed both sessions, and I'm sure that our audience are grateful for your time and your sacrifice. And we hope that you have the best of experiences as you continue to promote women's health and help women to live healthier lives. So this is where we bring the show to an end. And I just want to say again, we can't thank you enough. So on behalf of VivaFemini, thank you very much and have a lovely evening. So that is it, everyone.
Thank you.
We have come to the end of the webinar Know Your Body, Women's Wellness and Self-Awareness, brought to you by Viva Femini. And we know, yes, we know that you have gained a knowledge or two and it was worth your time. So till we come your way again, please make sure to do those things that keep you healthy. Eat right, more proteins, less carbs, drink lots of water. Make sure you exercise, okay? Keep that body moving, keep those muscles working. Prioritize rest and anything that will jeopardize your mental wellness, anything that will stress you out, stay away from such. And always make sure that you keep your doctor's appointments, no matter the stage of life you are in. Prioritize regular checks so that you will be in the know of what is going on in your body. So until we meet again, I am Joy and I hope that you have a wonderful evening. Ciao.